Hello everyone, this is Dr. Sagar, your PERIO faculty, and here we are going to discuss about this PAATHSHALA. This is a very important venture in which we have derived this new way of solving MCQs, not just solving MCQs. Here we go about our topic, our chapters, our subject, periodontics, in a very efficient manner which aims at saving the time but not leaving any topic at all. While we are solving those MCQs, we try to look at all the options. When we solve MCQs, at times we know which is the right option. Okay, and we do not even look at the rest of the three. But what we do here, we check all the options, like why they are incorrect, because that also is very important. At times when you have so many subjects, your mind can get cluttered at times. Okay, so you must know to differentiate what is correct and why it is correct, right? So like I said, there are so many subjects, the course is so vast, it becomes difficult at times to remember each and everything. So that is why this retrograde study comes into focus, where while we are solving MCQs, we can check how much grasp we have on our subject. And this is what we do in PAATHSHALA course. You may talk to the rankers who have helped immensely from this PAATHSHALA course. All the toppers, like in the last few years, last 2 years, 3 years, they have got tremendous amount of help from this PAATHSHALA course, because they say, sir, now our time, we save a lot of time. We do not need to study all the chapters again. Like you guys would have studied once, and few of you would have appeared also in NEET. Okay, so you know how the exam pattern is, what kind of questions are framed, and because preparing is an entirely different thing, and once you are in that exam hall, how are you going to solve those questions is an art, and in that frame of time which has been allotted to you. Okay, so you must be fully prepared to solve those MCQs in time. So this is very important in this PAATHSHALA course, and today in the next like 80-90 minutes or so, we will get to know how to go about solving MCQs, and at the same time get to understand our subject better. Okay, so I guess you guys are here. Whatever your queries are, you can post here on this chat. So a rough idea starts here in this. The first question, stippling is seen on, a very simple question. Okay, stippling is seen on, if you have studied the chapter of anatomy on periodontium, gingiva and periodontium carefully, you will know that stippling is seen in attached gingiva. Okay, what is stippling? Knowing this is very important, because on stippling you can get 5-6 different questions. Okay, first of all, stippling gives an orange peel appearance. Okay, stippling gives us orange peel appearance. It is seen in attached gingiva. What is stippling? It is mechanical reinforcement. Stippling occurs in attached gingiva to save the gingival structure from mastication forces, from mechanical damage. That is the importance of stippling. It arises because of depressions and elevations in the gingival surface. It is a change in gingival texture. Okay, it is a phenomena, it is a feature of gingival texture. Another very important thing, stippling is absent at birth. Okay, in infants it appears at about 5 years of age. It remains there till adulthood, and then as you grow old it disappears. And also very important, it will disappear during inflammation. All right. So this is how we got to know so much about stippling. Not just like if we were concentrated only on solving this MCQ, the stippling is seen in attached gingiva. No, we cannot do that. We know in interdental papilla and in marginal gingiva, we do not see stippling. But what else can we ask about stippling is important for us to. So while we are studying the chapter about the clinical features of gingivitis, okay, or what are the changes like how to differentiate gingiva when it is healthy or while it is inflamed. So when you are seeing the chapter, when you are doing these questions, you can go behind and check. Okay, so you do not need to study the chapter again and again while revising. When you are doing questions, you can prepare a notes side by side, 3-4 lines in every question. If you can write, the amount of time that you give in revising the topic can be saved a lot, and it will allow you to solve many other questions in all the other subjects. Okay, moving on to the next one. With the increase in age, what happens to the keratinization of gingiva? Now guys, this is a very tricky question because all the year round and year after year people get confused in this question. So what is this saying with the increase in age? When it says increase in age, it is talking about aging. It is not saying like when you are 1 year old and when you go 3 year old, or when you are 10 year old you become 12 year old. No, it is talking about increase in age when you are getting older. So with age, what happens to keratinization of the gingiva? Keratinization of the gingiva decreases with age. Okay, because people, I mean, you guys ask me this question every year this remains a doubt. Sir, stippling, this keratinization from childhood to adulthood, it increases. At birth, it might not be there, but then it increases. So the answer can also be increased. No. Okay. When it says with the increase in age, it is talking about once you go from your adulthood towards the old age. Okay. In that case, the answer would be it decreases. Keratinization of the gingiva is very, very important when it comes about the protection of the gingiva. Okay. Whenever the gingiva becomes inflamed, it goes from keratinized towards non-keratinized. Okay. The color of the gingiva is due to, okay, very important question. What all are there? Capillaries, they bring blood. Thickness of the epithelium. We were just talking about keratinization. Thickness of keratinization and pigmentation. Okay, we can say safely that all of the above is the answer. Color of the gingiva. What is the color of the normal gingiva? It is coral pink. Okay, coral pink is the color of the normal gingiva or the healthy gingiva. We have seen that color can go to red, okay, when it is inflamed, or you can say when degenerative changes are going on, or it can go towards pale. The color can become pale when proliferative or reparatory changes are going on in the gingiva, right? When the keratinization becomes less because of the inflammation, the color will go towards red. Okay, so the color of the gingiva and pigmentation, right? Pigmentation, when there is high pigmentation, it can impart black color to the gingiva. Okay, it can go towards the brown. Now when we are talking about pigmentation, you guys must also remember that there is this GOVT and DUMET classification about oral pigmentation. The question can be asked on that topic also. So while we are solving one question, we must know, we must learn how to link, how to relate. And when you start doing this, guys, you will not just relate topics in a chapter. You will get to relate few different chapters, and then at some point of time, you can correlate between subjects also. Okay, this can also happen. It's like inception sort of thing. It can go from one thing to another. But that, if you are able to do that, It means your basics are getting strong. Your foundation is very strong, that you have thorough knowledge of everything, of every subject. All right. Junctional epithelium, guys, very important topic. Every year we can expect a question to be asked on junctional epithelium, right? So, and in all this chapter we have selected, because this is a very important chapter, the anatomy of the periodontium, the structures, the gingiva, the periodontium, alveolar bone, cementum specially. These all are very important topics. Every year we can expect 1 or 2 questions from this, right? Junctional epithelium. Options: lines the gingival sulcus. Before starting with the questions, what did I talk about? Like, we have to see all the options, which can help us understand everything. What lines the gingival sulcus, guys? Okay, I expect you guys to answer. Sulcular epithelium. Okay, sulcular epithelium lines the gingival sulcus. Junctional epithelium is permeable. Yes, it is permeable. Okay, so we can see like this could be our answer, but we have to see other options also. Is derived initially from the outer enamel epithelium. Now, this is a tricky part. Yes, outer epithelium is there in the formation of, but initially it is derived from reduced enamel epithelium. Okay, this is the crux, and it is attached to enamel by not desmosomes, by hemidesmosomes. Two different structures are never connected by, attached by desmosomes. They are always connected by hemidesmosomes. Okay, please remember this thing. Two different structures will always be connected by hemidesmosomes. So the question will be permeable. Now in this, I would also like to tell you which type of epithelium is semi-permeable. Sulcular epithelium. Sulcular epithelium is semi-permeable, right? Dentogingival unit comprises of, very important part, dentogingival unit. What does dentogingival unit do? It helps in attachment of junctional epithelium to the tooth structure, right? Gingival fibers alone do not comprise dentogingival unit. Gingival fibers along with junctional epithelium make up dentogingival unit. Okay, they help in attachment of the junctional epithelium to the tooth surface. They help in the embracing of marginal gingiva against the enamel. All right. Free gingival groove represents. What is the other name of free gingival groove? First of all, first questions which can be created here. Free gingival groove is also known as marginal groove. Right, guys? Now, where it is located? It demarcates marginal gingiva from attached gingiva. Okay. What does it represent? It represents histologic depth of gingival sulcus, false pocket depth, depth of gingival sulcus, none of the above. No, it cannot be answered, none of the above. Free gingival groove is the marginal groove. It represents the true depth, which is the histological depth. Depth of gingival sulcus is your probing depth, which can vary as per the state of the gingiva. When it is healthy, it will be different. When it is inflamed, the depth of sulcus will be different. All right, but histological depth of gingival sulcus is where there is actual attachment of the gingival fibers on the tooth surface, and that separates the marginal gingiva from the attached gingiva, right? Because marginal gingiva is unattached. Attached gingiva, as the name itself says, it is attached. It is firm and resilient. Okay, so this helps in understanding that what is free gingival groove. All right, guys. Next, stippling. Now, if you remember in the first question itself, what I was telling you about stippling. I was telling you that stippling is absent at birth, at infancy. It appears at around what age? 5 years of age. Okay, then it increases till adulthood and then it goes away, right? So it will be absent in both infants as well as old people, right? In both infants as well as old guys, right? Not just stippling. In this chapter, the changes in consistency are important. Contour, Stillman's claps and McCall's festoons. Those are very, very important. We can expect a question to be asked every year. All right. Next, junction epithelium is attached to the enamel by. I was explaining to you a short while ago that two different structures are attached by hemidesmosomes, right? Reticular fibers, they are there to form a network between the principal fibers. Desmosomes, two epithelial cells are connected by helps of desmosomes. Collagen is your main protein of your principal fibers. Okay, desmosomes, it connects or it attaches is the better word, guys, connects epithelial cells, right? What type of cells are most numerous in gingiva? This you have to tell. Which type of cells are most numerous in gingiva? What all kind of cells are there in the gingiva? This also we must know, right? So the type of cells which are most numerous in the gingiva are keratinocytes. They are present more than 90%. Okay, or you can say the main bulk of gingiva is formed by keratinocytes, right? Keratinocytes are the principal cells of the gingiva. They give rise to whole of the gingiva. That I like a lot. Like now you guys are contributing. Now you are there, because till now it was like I was talking to myself. But good to see you guys. Good to see you here. Okay. And now we will connect a bit more. Okay. And I hope you guys are enjoying this session. And as you can see, you all have given the correct answer, which means your basics are solid. This is a very encouraging sign. And guys, I will say, like, from our side, from my side, we can do as much as is possible in this PAATHSHALA course, right? We are there for you all the time. We will help you in solving MCQs. Like in if I say in PERIO alone, if we can do more than 1,000 questions, which I will be making you do more than 1,500 questions, then we won't leave any topic, any para untouched. Topic is a bigger thing. Okay, we won't leave even a para untouched. Okay, so then you won't be afraid about like from where a question can come in the exam. Okay, you will be fully prepared. Okay, and for that you have to remain positive. Gingival coal, an easy topic, but it is a tricky topic. Right? What is coal? First of all, you need to tell me what is coal. Which part of the gingiva is coal? It is your interdental gingiva. Okay, interdental gingiva can be of two types. It could be pyramidal or it could be coal shaped. Okay, it could be pyramidal or it could be coal shaped. When it is coal shaped, it is depressed and it is non-keratinized. Okay, when it is coal shaped, it is non-keratinized, and when it is non-keratinized, it becomes, what is the significance of coal being non-keratinized? It becomes prone to inflammation. Yes, good dog, good. Non-keratinized. Okay, it becomes prone to inflammation. I'll show you this image. If you can see this image on your screens, right? I mean, it just struck my head that free or marginal gingiva I had to show you. Okay, I couldn't have left it like this. See, this is the marginal groove. Okay, it separates the marginal gingiva from the attached gingiva. Then there is this mucogingival junction. Mucogingival junction separates attached gingiva from the alveolar mucosa. And this is the V-shaped space. I'll enlarge it further. This V-shaped space, it is your gingival sulcus. V-shaped crevice. This is your gingival sulcus. Right? Moving on. Gingiva is supplied by. What is the blood supply of gingiva? Three sources. Vessels of PDL, arterioles emerging from interdental septa. Doc, if it was in my hands, Dr. Singh, and then I would have given you a hamper at this moment, a prize at this moment. But if every one of you keeps on giving me right answer every time, I will be coming short of these hampers. Okay, so the third source is supraperiosteal vessels. Okay, so why did I tell you this thing first? That what if these options are there in the exam and in place of supraperiosteal vessels, you have vessels of PDL or arterioles from interdental septa. Okay, so you must be ready for all the answers. Or the question could be asked like gingiva is not supplied by, and along with these three options, you get the incorrect one. So you should be knowing everything. Yes, like you said, it is supraperiosteal vessels. Next, moving on to the next. The junctional epithelium is attached to the tooth by. Now, amongst the options, the answer will be different, or it could be hemidesmosomes. So now you have to see what in desmosomes, no, cuticle, no, cuticle is an entirely different thing. Naismith's membrane, no, not in a grown up tooth. So the junctional epithelium tooth is basal lamina, guys. Now I would have loved to know your response on this. That what is basal lamina? A very, very important thing this basal lamina is. Yes, good. You see this. I hope this is entirely visible to you. This image. Okay, basal lamina image. In this, we can see external basal lamina, which is towards junctional epithelium, and towards the tooth side, there is this internal basal lamina. Okay. Desmosomes, you can see these are the desmosomes. They are attaching the epithelial cells. And hemidesmosomes, they are attaching the tooth surface to the epithelium. CEJ, here it is. Okay, so this is a very beautiful diagram which explains clearly the basal lamina. Alright. About basal lamina, how much thick it is, right? That 300 to 400 angstrom. What are the two layers of basal lamina? I hope you guys write it down in the comment section, because I will wait for somebody to write what are the layers of basal lamina. Okay, I'm waiting for you guys to write the layers of basal lamina, because basal lamina is very important. Okay, the two layers are lucida and densa. Lamina lucida and lamina densa. Lamina lucida is towards the epithelium side. Lamina densa, it is towards the connective tissue side. Lamina lucida is rich in good dog, good, very, very good. Laminin and densa is rich in collagen type 4, C4. Okay, great guys, great. I am already very much impressed with you. Okay, so I mean, I guess this is the beginning of your session. If you stay like this, you will get through in the next year's NEET. Okay, with us, all you require is a bit of tweaking with PAATHSHALA, nothing else. Gingiva is attached by another question, which is like says the same thing but in a different way. Gingiva is attached by junction epithelium, epithelial attachment, reduced ramal epithelium, not the other. No, junction epithelium is attached by gingiva is attached by junctional epithelium along with gingival fibers. Okay, junctional epithelium and gingival fibers help in the attachment of gingiva. The tea tasted better when you guys started contributing here. Any point that you guys want to add in question number 13, you tell me. Okay, attachment of the gingiva is very important. This, which we were seeing here, this was the attachment. This is the attachment here. Okay, junctional epithelium along with the fibers is getting attached. Next, length of the junctional epithelium. This is something which you just have to remember. And there are a lot of questions in which they talk about like what is the depth of gingival sulcus, what is the height of marginal gingiva. Okay, probes, about probes, what is the diameter of the tip of the probe. Why not B, sir? Thank you for asking this question. Gingiva is not attached by epithelial attachment. Like, see, attachment is something which has happened. Okay, it is attached by junctional epithelium along with the gingival fibers. If the option was dentogingival unit, then that could have been the answer. Okay, if there was dentogingival unit, I could have gone for that. All right. The length of junctional epithelium is simple in this. I will not get confused. 0.25 to 1.35 mm. Okay. In early days, it is 3 to 4 cell thick, the junctional epithelium, but when it becomes mature, it gets to 10 to 20 cells in thickness. All right, it gets to 10 to 20 cells in thickness. Least width of attached gingiva is found on facial aspect of. Now, we must know least width and also the maximum width. Maxillary first premolar 1.9 mm. Okay, and at mandibular first premolar it is 1.8 mm. Okay, so that is the least width. Now I'm not going to write it. You guys will only tell me what is the maximum width of attached gingiva and where is it found. What is the maximum width and where is it found? No one. In the incisor region. Very good, doc. Very good. Very, very impressive. Okay, 3.5 to 4.5 in maxillary incisors. Of course. And in mandibular one, 3.3 to 3.9. Now you guys have to correct me. I am right or wrong. Yes, good. Okay, because you are going to appear in the exam. And you see, uh, this thing my teachers used to tell me that they are not going to sit an exam. I have to sit an exam. So my knowledge must be greater than the teachers. Teacher is there to guide me, correct me. But you must reach that level when you can discuss or at times correct the teacher also, your faculty also. Okay, develop that confidence, and that confidence will be developed only when you have that thorough knowledge of the subject. Clear? The area which is most prone to infection. I have already told you among the options: marginal gingiva, sulcular epithelium, interdental pole, attached gingiva. It is interdental pole because among these four, it is the only non-keratinized area. Keratinized thing is there to prevent the infection. Okay, so the area which is most prone to infection is interdental cone. Rest, sulcular epithelium, either they are keratinized or parakeratinized, right? Orthokeratinized or parakeratinized. Now that V-shaped space that encircles the tooth and present between tooth and gingiva is known as, what is that V-shaped space known as? I didn't know that it was there in the questions, but we have done it already. It is that V-shaped space which is bound on tooth on one side and epithelium on the other side. So they are talking about this gingival sulcus. Okay, sulcus depth. In clinically healthy gingiva, how much it is? 2 to 3 mm. Okay. In clinically healthy gingiva, the depth of the sulcus is 2 to 3 mm. And ideally, what should be the depth of gingival sulcus? Ideal 0. Right? 0. What is the normal consistency of the gingiva? Yes, 2 to 3. The normal consistency of the gingiva. Consistency, contour, texture, position, size, color. You guys must be thorough with all these features of gingiva. Okay. So the normal consistency of the gingiva is soft, hard, firm, and leathery. The normal consistency of the gingiva is firm and resilient. Right? Good. It is firm and resilient. Attached gingiva gives it that consistency. So when it is leathery, in what conditions it becomes leathery? It will become leathery when you are doing that forceful toothbrushing. Okay, that will give you leathery texture. And the normal consistency, when the consistency will become soft, it will become soft when it is inflamed. Right? It will become soft when it is inflamed. Clear, guys? After the tooth emerges to the occlusal plane, the clinical crown height increases by? Very important question. After the tooth emerges to the occlusal plane, the clinical crown height increases by? Tell me. You people will tell me this question. Pyramidal gingiva in between, I just saw the images were there. I'll show you the images of, see this. Interdental papilla, central portion. In the top image, it is pyramidal. Okay, this is pyramidal. While here it is, the depression is there. Okay, the coal is being formed. Okay, an absence of papilla and coal where the proximal tooth contact is missing. So when there is like the shape of the papilla, no, it is dependent on how close the two teeth are, where is the bone crest located, whether there is recession present or not. So okay, on these things it depends. After the tooth emerges to the occlusal plane, the clinical crown height increases by passive eruption. This is the crown structure and this is the root. What is this? CEJ. So what is above the CEJ? That is your anatomic crown. Okay. What is below the CEJ? It is your anatomic root. Alright. Now, if there is recession, so clinically what is visible is your crown. Clinically what is invisible is your root. As simple as that. Okay. So active eruption when tooth is actually moving occlusally in the occlusal direction. That is your active eruption. Movement occlusally. Post emergence growth spurt, when it is emerged, when it has come out from the alveolus, then it will have spurts in which it will reach the occlusal plane. Okay. Gingiva in children, another question in which you guys get confused. From children or from childhood to adulthood, the keratinization increases, which means it will be less keratinized. Also, stippling, it appears at 5 years of age and it increases till adulthood and then it starts to disappear. So the answer will be less keratinized and less stippled. Good. Good dog. Good that you guys know. But I see the familiar names now again and again. So not everyone is interested in. Few are like that in every WhatsApp group. No, there are silent members. So here also we have silent members. And few are those the chirpy ones, the talkative ones. But yes, it is good to be expressive, guys. This I will say. You have to be expressive while preparing for NEET. What do I mean by being expressive? That while you study, like everyone has his own formula or pattern of study. But I will suggest that while you study, right, if you're studying in a group, you guys discuss whatever you know, whatever is coming out of your mind. You just spit it out. Okay, because then only you will remember whether I spoke correctly or incorrectly. So you must express whatever is there in your mind. It will help you in remembering the correct ones, and it also will increase your speed of recalling, because while you are sitting in the exam hall and you are trying to recall something, and if you are able to recall once you are out of the exam hall, it does not matter at all. Okay, so while you are explaining, like you are at the 10th question and now the correct answer is not coming into your head, then what you should do? Will you stay at that question? No, you move to the next one, because a part of your mind has already started working on that. Now, how quickly you are able to recall will depend on how much you have invested in that question. And by investing, I means whether you have studied it or not, whether you have discussed it or not. So once you discuss a lot with your group of friends, with your teachers, when you ask doubts, then that thing stays in your head. When you do not ask your doubts, when you remain shy or whatever is this, whenever you are underconfident, it will harm you in the long run. That I'm telling you from personal experience, from experience of teachers, I mean students every year, guys. Okay, in this PAATHSHALA course, I am encouraging you guys to be expressive, to speak out, to stay connected. Whatever you want to ask, you please ask me. Whenever you have a doubt, you come to me, you ask me. Like in this question, we have this doubt. In this topic, we are having this doubt. Like somebody asked me, sir, why not A or why not B? Something like that. There was a question. So when you start doing those things, when you start asking questions, things will become clearer in your head. Okay. Normal depth of gingival sulcus in adults does not exceed. Question number 21. Normal depth of gingival sulcus in adults does not exceed. Already done this? 2 to 3 mm. Okay. The depth of the gingival sulcus will not exceed 2 to 3 mm. Need a bit of water. If you guys have anything in your mind, you can type it out. All right. Next, elanin, eolanin, elanin, whatever it is, fibers are found in. Elanin fibers are type of elastic fibers. Okay. What are the different types of elastic fibers are there? Oxytolin, elastin, and elanin. Okay. So this elanin is found in PDL. Okay. Oxytolin fibers function. It helps in regulating blood flow. Okay, it helps in regulating the blood flow. Function of Langerhans cells. Very important type of cell, Langerhans cells. Okay, 5 or 6 questions can be framed on Langerhans cells. Right? Function of Langerhans cells is to, before that, Langerhans cells, they are present at suprabasal level. What do you mean by suprabasal level? That they are absent in the basal layer. When I talk about the layer, it means there are different layers of the epithelium. How many are there? There are 4. Basal at the base, at the bottom. Above it, which layer it is? Spinosum. Then there is granulosum. Then there is corneum. In orthokeratinized, there are all 4 layers. In parakeratinized, granulosum is absent. Okay, this way I'll show you those layers also. See this: basal, spinosum, granulosum, corneum. Right? Basal, spinosum, granulosum, and corneum. All right. Very important figure this is, guys. Keratinohyaline granules. They are very numerous in the stratum granulosum. Right? Corneum is the topmost layer. They are devoid of nucleus in orthokeratinized. They have a pycnotic nucleus in parakeratinized. Functional nucleus in non-keratinized. Right? Spinosum. It has outline bodies. Okay, you guys must be knowing all those things. Like the way you are, I know. Now, what is the function of Langerhans cells? The function of Langerhans cells is antigen presentation to lymphocytes. They contain which granules? You tell me. I know you guys know it. Verback granules, sulfur containing granules. Okay, they are a part of reticuloendothelial cell system, right? They are part of reticuloendothelial cell system. Langerhans cells are absent in, next question, Langerhans cells are absent in junctional epithelium. They are part of circular epithelium, oral epithelium, but they are absent in junctional epithelium. Okay. Langerhans cells, keratinocytes, Merkel cells, melanocytes, four types of cells of gingival epithelium. Keratinocytes make up the bulk, more than 90-95%. And in rest, there are the rest 3 cells. In fact, the rest 3 are together called as non-keratinocytes. Which type of periodontal fibers are consistent and are reconstructed even after the destruction of bone? The type of fibers which are reconstructed even after the destruction of the bone are the ones which are not attached to the bone, and they are transeptal fibers, right? Transeptal fibers are also considered in gingival fibers. Okay, they are also considered as gingival fibers. Why? Because they do not have osseous attachment. Okay, the transeptal fibers, they do not have osseous attachment, so that is why they are reconstructed even after the destruction of the bone. They also help in preventing the two teeth from separating from each other, which means they help in preventing pathological migration, the transeptal fibers. In periodontal ligament, there is which type of collagen? The principal fibers of the periodontal ligament, they are made up of type 1 collagen. Okay, principal fibers, they are made up of type 1 collagen. Remember this, guys. Simple one. Periodontal ligament is, the next one, the periodontal ligament is, you can say the periodontal ligament has hourglass appearance. Or why? Because it is thick at the top, at the base, but it is narrower on the mesial side. Why? Because there is pressure area on the mesial side, and on the distal side there is the distal one. All right, 27, simple question, guys. Periodontal ligament, it has hourglass appearance. There is another kind of question which can be asked about this, that periodontal ligament is thinnest at, it is thinnest in the middle or at the fulcrum. It will be thinnest at the middle. Okay, good question. Question number 28. The periodontal ligament derives its blood supply primarily from the branches of vessels entering the pulp. I don't think so. Periodontal ligament derives its supply from the branches of vessels which are entering the alveolar bone and gingiva. All right. It has a slow rate of turnover. No guys, no. In fact, it has a very fast, rapid rate of turnover. It contains epithelial cells of molasses. This seems promising. What are epithelial cells of molasses? Remnants of Hertwig's sheath. Alright? And it comprises primarily of type 1 collagen. Okay? It comprises primarily of type 1 collagen. So this is how we are able to solve all the 4 options. Okay? So please remember, while you are solving, you must look at all the options. You just do not concentrate on one option or 2 options or just at the right option. PDL is thinnest at. PDL is thinnest at, I just discussed with you, 29 guys. Tell me. PDL is thinnest at middle, not at the apex, not at the top. Okay, you guys are not asking me anything. Not much time is left, guys. I would love to have some conversation with you to share my experience, whatever you guys doubts have at this moment about preparing, about going about PERIO. Good thing about PERIO is our subject is very easy, right? We at PAATHSHALA make it much more easier, and there is just one book, Kerenza, that you have to read. Okay, apart from our notes, time to time you have to go to Kerenza to just check what you have studied to make it clear with the help of images and everything. What type of fibers are the principal fibers of PDL? What type of fibers are the principal fibers of the PDL? They are collagenous. Reticular are again, like they are of collagen type 3, type 4. Okay, but they are not the principal ones. The principal fibers are collagen type 1. Now, in this question, not much, but the next one, periodontal fibers, which are more or most resistant to forces along the long axis. Which are those fibers? Most resistant to forces along the long axis are, tell me, 31. Good. They are oblique. Oblique fibers are the largest, most numerous, and they help in resisting the vertical forces. Apical fibers, they help in preventing extrusion. Okay. Transeptal fibers, already told you, they help in preventing teeth from separating in question 28. When principal fibers are type 1, in question number 28. No guys, sorry. Hey, come on. I said type 1. Answer is C only. Contains epithelial cells. Answer is C only. Sorry, I mean, I by mistake would have done on this. I wrote no here, type 1. The answer is type 1 only. Sorry, by mistake I did that. My bad, doc. Thanks for correcting me. Okay, I always wanted to say type, I mean C is correct, but the tick mark, what? And now C, this silly mistake I can afford, right? I'm not sitting in the exam hall. But in the exam hall, while filling your OMR sheet, you have to be very vigilant. This type of mistake can prove to be very costly. Okay, so now here oblique, correct. Okay, transeptal, I already told you, preventing migration. Alveolar crest, lateral forces. Okay, they help in resisting the lateral forces, the horizontal forces, torsional forces. All right. Thixotropic theory. You guys ask me this question also a lot. What is this thixotropic theory? What does it claim? Okay. This thixotropic theory, what are the different theories? Tensional theory. Okay. There is this viscoelastic theory. Thixotropic theory claims that principal fibers has the major responsibility in supporting. This is the tensional theory. The periodontal ligament has the rheological behavior of the thixotropic gel. Yes, this seems correct. Displacement of the tooth is largely controlled by fluid movements. This is your viscoelastic theory. Okay, so B is correct. It behaves like a gel. Alveolar bone is a type of compact bone, cancellous bone, spongy bone, or none of the above. You guys tell me. 33. Alveolar bone is compact bone. This here is your alveolar bone, right? It is a kind of compact bone. Yes, it has some part of cortical bone. It has spongy bone as well, right? There is this basal bone also, but alveolar bone is a type of compact bone. Alveolar bone proper, supporting alveolar bone. Okay, the structures of alveolar bone you must remember and you must recall correctly, guys. Anatomic forms of roots of tooth are determined. This question is discussed in more detail in dental histology. Anatomic form of root is determined by dental lamina, no. Neural crest cells, no. Hartwig's root sheath, yes. Hammock ligament, no, guys. This question is more of a dental histology question. So at time I was telling you about the connection between different chapters. So when you see this kind of question, you must go back to your dental histology. Okay, because in dental histology, the development of the tooth becomes very, very important. All the stages and everything of the development of the tooth, that question becomes very important. Gingival sulcus is V-shaped and it barely permits the entrance of 35 periodontal probe. Rest of the things, they are used for scaling and root planing. Hoe, sickle, curate is for root planing. Okay, very important topic this is, guys, the periodontal instruments. Sickle, triangular section, everything in this. Anterior sickle, posterior sickle, hoe, 2-point contact, 99-degree angle. Okay, all those things are important. Gingiva sulcus is V-shaped and it barely permits the entrance of periodontal probe. Which of the following are the predominant connective tissue cells of the periodontal ligament? In periodontal ligaments, the most abundant structure is fibers. Along with fibers, there are cells and brown substance. All right. So, which is the predominant type of cells of the periodontal ligament? It is a very, very easy question. The predominant cell is, they are fibroblasts. And remember, fibroblasts perform the dual function. Okay, they perform the dual role of what? Phagocytizing the worn out cells, the old cells, right? There are osteoblast and osteoclast, cementoblast and cementoclast, odontoblast and odontoclast. But in PDL, fibroblast does the dual role. So this is very important. This you have to remember. In different fibers, they do not have an important function. They are lying haphazardly along with the principal fibers of the periodontal ligament, and they are made up of collagen. Okay, indifferent fibers are made up of collagen. So not much to discuss in this. 38 is very, very important. With aging, changes in PDL. What happens with aging in PDL? The cells increase, the collagen fibers decrease. Okay. The cells will increase, the fibers, the collagen fibers, they will decrease. Okay. So the number of elastic fibers, they increase, right? There will be more insoluble collagen. Okay. There will be more insoluble collagen with aging in PDL. Functions of periodontal ligament. Nutritive, sensory, formative. All are the functions of periodontal ligament. Not much to discuss in this question. I like to discuss every question, but in this, I mean, if you are studying, if you are preparing for NEET, then there are certain questions which are like A for apple, P for ball. Okay, it is that sort of question. So you must remember, guys. And one thing while preparing should be there in your head, like whoever gets selected, then it's not that they are solving the very difficult question ones. More than that, they do not do incorrectly the basic questions which are expected of you to solve. Okay, so when your preparation is foolproof, it is solid, you will be able to do maximum number of questions because they are straightforward from the chapters, and also like even if they are logic based. So if your knowledge is solid, if your knowledge is thorough, you will be able to solve. Okay, but if you are not able to recall all the topics, then it will be difficult for you. Then you can make silly mistakes also, because like if in a row you get 2 or 3 questions which you are not sure about, right, then doubt starts creeping in your head, and that is very you can get jittery, you can become nervous, and that does not help in the exam hall. Okay, and whenever that happens also, guys, I will tell you, in the first, I mean, when you have you start doing the paper, I mean, solving the paper. In the first instance, you see the question. If you are able to solve it instantly, solve it. If it is taking your time, you move on to the next one. Because like I said, a part of your brain will start working on that question. Okay, so you do not waste time in the first time itself in the paper. Like there are 100 questions. 20 or 30 will be there which won't require a second for you to solve. Then few will be there which will require take 2 or 3 seconds or 5 seconds. Very few will be there which will require 2 minutes of yours. Okay, like if in the beginning there are 5 questions which require like at least 1 minute of yours, then what you will do, you will waste 5 minutes of it. You see that question, you move on to the next one if you are not able to recall it, and that way you will save a lot of your time, right? Feature of aging periodontium. Tell me, question number 40. What are the features of aging periodontium? Simple, scalloping of cementum and alveolar bone surface, right? This is feature of aging periodontium. Increased cell size, no. Number, no. Lacunae in bone can be there but not in cementum. Okay. 41 is important question. Unattached gingiva. You people tell me, what is unattached gingiva? What is unattached gingiva? You tell me another name. I'm not asking you to give me the answer of 41. Which gingiva is unattached gingiva? Yes, this is marginal gingiva. Okay. It can be separated by probe. It is above the mucogingival fold, right? And interdental gingiva, guys. Okay, I am asking you, what is interdental gingiva? Tell me. Interdental gingiva is comprising of both marginal as well as attached. The margins are non-keratinized. They are of marginal gingiva. The central part is of the attached gingiva. This helps in solving a lot of questions. The oxygen consumption of novel gingiva, this question can get repeated again and again. Not very like a significant sort of question, but yes, we have to solve all kinds of questions. We must know all kinds of questions. It is 1.6 plus minus 0.3, right? Good. Black line on the gingiva which follows the contour of the margin is due to. A black line on the gingiva which follows the contour of the margin is due to. Lead, it gives you Bertonian line. Remember. And black line is given by, there are 3: bismuth, arsenic and mercury. You can write like this. Don't go into chemistry. We are not Breaking Bad. Okay. BAM, bismuth, arsenic, mercury, and they will give you a black line at the marginal gingiva. Okay, whatever discoloration happens, it happens at the marginal gingiva, right? Bismuth, arsenic and mercury. Basal lamina consists of laminin and, already told you, type 4 collagen fibers. I am asking you one thing. What is the length of anchoring fibrils? What is the length of anchoring fibrils in basal lamina? Remote. Good. 750 nanometers, guys. Good. Not microns. Good. All right. It is 750 nanometers, guys. It is not 750 microns. I saw somebody wrote microns. 750 nanometers, right? Next one. Dendritic cells located among keratinocytes at all suprabasal level and belonging to reticuloendothelial cell system derived from bone marrow are 45. Good. Langerhans cells. I mean, this becomes clear from this only. Suprabasal level. Okay. Dendritic cells located among keratinocytes at suprabasal level and belonging to the reticuloendothelial cell system. Already discussed with this, you guys. Elastic fiber system present in the lamina propria. What is lamina propria? Lamina propria is another name of gingival connective tissue. Elastic fiber system present in the lamina propria consists of all of the following except oxytocin, elastin, elastin is there, collagen. It is not part of elastic fiber system. Which of the following amongst these is non-keratinocytes? Simple question. Langerhans cells, the name is incorrect, but non-keratinocytes. What are the different three? Melano, Merkel, and Langerhans. Okay, these three are non-keratinocytes. Cementum found on the cervical third, guys. This Schroeder's classification of cementum, very important. Okay, very important. This Schroeder's classification of cementum. 4 kinds of cementum is there, and it is very important. Acellular, afibrillar, acellular extrinsic fiber. Okay, cellular mixed stratified, cellular intrinsic fiber cement. Okay, their lengths 1 to 10 microns, 30 to 230 microns, 100 to 1000 microns. It is present in the resorption lacunae, right? What is found in cervical third? What is found in apical third? In simple terms, in cervical third, acellular cementum is found. In apical third, cellular cementum is found. Okay, so the answer will be A, but can also be B, right? Acellular extrinsic fiber cementum. Cementum is very important, guys. Cementum is avascular. Okay, cementum is avascular. Cementum forms the covering of your anatomic root. "49. The cell that is present in spinosum and basal. Important question, guys. In book, it says deeper layers. Okay, the book says deeper layers about Merkel cells, melanocytes. But when it is asked like this, the answer will go for melanocytes. Okay, the cell that is present in stratum spinosum and stratum basal is melanocyte. Again, the periodontal ligament is thinnest at 58, sorry, none of the above. It is thinnest in the middle, which is not amongst the options. Right, guys? So see, this is how we got to know like how we are going to solve the MCQs. Like I said in the beginning, if we are there to solve just MCQs, then multiple question books are there. And talking about multiple question books, your question banks, in this course, we solve or we correct the incorrect answers also, the controversial questions also, right? Because you guys spend a lot of your time in solving those incorrect questions which are given in question banks. You trust those question banks a lot, but the problem arises when you mug up or when you form in your head a concept which is incorrect because of that question bank, because we trust that question bank. Anyone, okay, question banks are very important. They help in assessment, okay, our assessment of these things, uh, the chapters, the topics that we have gone through, our study material. But if the answer is given incorrectly, then it shakes your belief, it shakes your system. Like, I had studied collagen type 4, but here the answer is given as collagen type 3. You people ask your faculty, so it is correct or it is incorrect. Okay, and so there will be questions in every subject there are. So we are there to correct those questions. And guys, once we have corrected it, you just take it as that. You do not change again and again, or you do not stay in a dilemma like whether what sir has told is correct or what is already given in the question bank is correct. Because you have multiple ways to confirm it. The first one, us, and the equal one is your textbook. For PERIO, it will be Kerenza. You will find answer to every question in Kerenza. But in this course, we are solving as many questions that no topic will remain untouched. Okay, so this thing I wanted to tell you very importantly about question banks, that do not rely entirely on those question banks. Question banks are there to help you judge what you have studied all through the year. And one more thing I will tell you, like when you are solving these questions daily, you have to solve MCQs. You devise a plan, like for PERIO, you are giving 10 days. In 10 days, we will cover the whole of PERIO. The study part, the questions part, and the doubts, the most important one. Whenever you are doing a subject, a chapter, or a topic, once you have studied it, once you have solved the MCQs, like out of 10, 8 you were able to do correctly. Out of those 8, 5 you did not even have to waste a second. Okay, it was there in your head instantly. Rest of the 3 you have to study, and the 2 that you were not able to do correctly, for that you have to study then and there. Do not keep it for later, because once you leave it unsolved, or you have not confirmed, or you have not corrected yourself, you have not gone through the theory or the text of the question, it will remain as such the whole year. Okay, people who get a lower rank, or unfortunately who do not get selected, they do this mistake often, that they keep their doubts unsolved. So the doubt solving has to happen in the first time itself. Okay, at that point when you are doing, once you are done with the topic, then you move to the next one. Okay, initially it will feel like you might have given 1 or 2 extra days from your scheduled plan. Like you thought, Perio, I will finish in 10 days, but it has taken me 12 days. But those 2 days will be fruitful to you when you finally sit in the exam. And it's not like in every subject, in every topic, you will have to give extra time. But whenever you are have to give yourself some time, do give it. Do not stay like, no, I have to finish the course. Then I'll feel good. Finishing the course without solving the doubts makes no sense. Because you are there to get selected, to get a good rank, to get a college of your choice, to get a branch of your choice. And that will be possible only when you leave no pace untouched. Okay, your study has to be foolproof, guys, because this exam is relentless. Everyone around you is leaving no stone unturned to get selected. Okay, you have to be on your edge all through the year. That does not mean that you will stay tensed. Okay, you have to stay relaxed. You have to maintain that balance, because there will be days when you will feel low, when you can get nervous. We are there for you. You always talk to us. We will help you in understanding everything, all the concepts, all your doubts, okay, in this course. But you have to stay persistent. If you want to take a day off, you take, no issues. But you take that day off just to recharge yourself. Okay, the way we charge our phone or everything. When you have refueled it, then you go back to the grind. Okay, there is no shortcut to get selected. Everyone who gets selected, who gets a good rank, you won't listen like they say that I did not do anything, I did not study. People who just want to show themselves as pompous, they will say those kind of things. But no, whoever gets a good rank, he or she must have studied thoroughly. He must have given good amount of time. He must have respected the exam. And once and when you have done enough hard work whole through the year, like you guys would have appeared, you guys are post interns, you will be able to solve it. You will be able to give it a go. Anything in the next 4 or 5 minutes you want to ask me, you guys can ask me about this chapter, this topic, or anything else. You can ask me. I'm there for you. And then we will give a full stop to this session, which I feel was very good for me, because I saw you guys responded. You guys responded very positively, bearing 1 or 2, which is there, which should be there. Like there were 1 or 2 hiccups, but mostly it was near flawless performance from you guys. You were, you know, all these questions, you know your theory. Okay, and like I said in the beginning, there are chapter and there are subjects like conservative, prostho, anatomy, microbiology. They are the difficult ones. But perio is a scoring one. In perio, I say proudly that every year people score 100%. And you do not have to go outside of the scores to cover perio. I'll make you solve so many questions that everything will be covered. Nothing will remain untouched in your syllabus. That I can assure you. Anything that you guys want to ask me, you can feel free to ask. Okay, guys. Sir, clinical case based were lengthy. Yes, and took time. Remaining questions we will be doing in next session. This was just an orientation session for you. Remaining questions we will do next time when you are part of the course. Sir, clinical question based question. Yes, clinical based question will always be lengthy, guys. They will be lengthy because first they will tell you about the subject, about the patient, what conditions are there, and what does it wants to ask you. So clinical based questions will always be lengthy. But the way you are saying, it took time. Give question the respect it deserves. Okay. And when you are studying, give it some time. You have to give it some time. If you want to solve it in a hurry, you might miss one or two points which are there in the question. Okay, so giving you few extra seconds, and like I said, if there is a lengthy question in front of you, you can leave it and you move to the next one, which is not taking your time, which is like a one word question. Okay, that way you will be able to solve. Initially, you solve the easy ones. You skip, solve the easy one, move on to the next one. Come back. Not like I have to solve the eighth one first and then only I'll move to the ninth question. No, that ways it does not work at all. It cannot work like that in an exam. All right. So guys, on that note, I'll take your leave. I thoroughly enjoyed it and I wish you all the best. And I would love to discuss PERIO with you again and again and again and again. Few of you will be doing PG in PERIO. Few of you will be doing PG in Endo. Few are there, oral surgeons, periodontists, everyone is there. But I will be there for you every time whenever you want to discuss anything in PERIO. I will be there for you. Okay. So guys, on that note, I'll take your leave. Remember, in this course, we will be focusing on solving questions and solving your doubts, correcting your question banks, and making you learn all the topics in the shortest possible time. All right. Good night, guys. Take care. Goodbye.